Hello, my name is Dr. Gill. I've been asked to do a mental state examination on yourself today. Before we start, can I please confirm your name and date of birth?
Thomas Alby, 4th of January 2000.
Thank you. So in terms of doing that examination today, that's going to involve looking at your thoughts at this moment in time in the room. Would you have any objection if I took notes whilst we're doing so?
No, not at all.
Super. So to start off, can you tell me how I can help today?
My friends and my family have said that I'm not quite as I used to be.
Okay.
And so they told me to come into the doctors.
When they say that you're not quite as you used to be, do you know what they mean?
They sort of feel that I'm just slightly off these days.
Okay.
And they seem to say that I'm boring these days.
Okay.
And that I'm not being as energetic as I used to be.
I see. And how do you feel about that?
I think they're not wrong. I do find it difficult to get out of bed.
Mm-hmm.
And I'm not doing as many activities as I used to.
Okay. If I were to ask them, how do you think they would describe your mood at the moment?
Down.
Okay. And asking you, how would you describe your mood at the moment?
Tired.
Okay, tired. So tell me about that tiredness.
I sort of just don't have the energy or the want to do anything.
Mm-hmm.
I find it difficult to get out of bed.
Mm-hmm.
I still sort of get up, but it just takes a long time.
Okay. So today, for example, how have you done with sleep?
Not too great.
Okay. And when you say not too great, can you tell me about that?
I just find it difficult to stay asleep.
Mm-hmm.
I can fall asleep quite quickly,
Mm-hmm.
but I keep waking up in the night.
I see. And in the morning, do you feel refreshed? Okay. Thinking about energy for a second, how's your appetite?
Not as good as it was.
Okay, tell me about that.
I used to eat sort of 3-4 meals a day,
Mm-hmm.
try and eat regularly, but nowadays I tend to just skip my lunch and my dinner.
Okay.
I'm not bothered.
You're not bothered. Are you getting hungry with it?
Yeah. I just eat something quick and something like a takeaway,
Okay.
but not really caring about what I eat much anymore.
If you miss a meal, do you feel hungry?
Not.
Okay. And in terms of your the mood and things, is there anything today that's been going over and over in your head a lot?
Just sort of that I haven't revised enough for my exams that are coming up.
Okay. Do you feel that these are appropriate thoughts for where you are?
No,
Okay. How are they inappropriate as far as you're aware?
because I think I've put in quite a lot of effort.
Okay. So there's an element of fear. Is there anything that you find that you have to do to try and quell these thoughts?
Make sure I do enough questions a day.
Okay. So that sounds quite reasonable. Is there anything that you've done that might cause you harm, perhaps?
Not sleep as much to make sure I get those questions done.
Okay. And do you think that might be reasonable?
No.
Okay, so that may be something for us to reasonably look at balancing. But do you have any fears that mean you avoid certain things?
I avoid trying to have fun, because then that would make it difficult to revise.
Okay,
Yeah.
Are you frightened of having fun?
No.
So it's more that by having fun you're not spending time working? Would that be right? Okay, I understand that. But I'm going to use a specific medical word now. It doesn't sound like you've got a phobia there, at least.
No, I don't think so.
Okay, do you have any phobias that you're aware of?
No.
To that in mind, I'm now going to ask you some questions that we ask everybody about how your thoughts are at this moment in time. So obviously we've got a fear with regard to the exams, which is understandable. Have you had any thoughts that there might be somebody trying to hurt you?
No.
And obviously you've got your exams, which is going to be affecting you. But do you think you could be affected by any external forces?
I don't think so.
Good, that's very reassuring, thank you. I'd like to ask about your thoughts now. Do you think that anybody could hear your thoughts?
No.
Okay. Do you think somebody could perhaps put thoughts into your head?
No.
Okay. And we'll change that around. Do you think somebody could take those thoughts out of your head?
No.
Okay. Okay. Have you had any thoughts that you might have any special powers?
I wish.
And have you noticed anything that might have special significance for you?
Nope.
Okay. Have you had thoughts that anybody might be trying to control you?
No.
Okay. And any thoughts that people are doing or saying things that might have a special meaning for you that other people couldn't notice?
No.
Okay, so that sounds relatively straightforward. So I just want to ask some questions about how your mind works. So have you had what we describe as an abnormal perception? So seen something, thought it was something, but when you've had a look, it's actually not the case. Okay, so for example, you haven't seen a rope and thought it was a snake. Okay. Have you had any hallucinations where you've seen things other people haven't been able to?
No.
Thank you. Staying with that idea, have you ever heard your thoughts spoken outside?
No.
So, just to confirm with that, obviously you've said no. Have you ever heard a voice talking about you? Have you ever heard a voice telling you to do things?
No.
Okay. And have you ever heard a voice commenting about the things you're doing?
No.
So I just want to ask two very important questions, but can be quite difficult. Have you had any thoughts about hurting yourself?
No.
Okay, can I confirm with that? Have you had any thoughts you'd be better off dead at all?
No.
Okay, and have there been any thoughts that you might hurt somebody else? Okay, so far we seem to be doing well with all of these things. So I'm just going to have a look at your cognition, your ability to think at the moment. So could you please spell the word world for me, but backwards?
DLROW.
Yes, super, thank you. Can you tell me the date today?
20th of January 2026.
Okay, and can you tell me the day?
Wednesday.
Super, thank you. And which hospital are we in?
Warwick Hospital.
Okay, and which county is that in?
Warwickshire.
Super, thank you. So I'm going to give you 3 words to remember: ball, cat and table. Can you repeat those back to me?
Ball, cat and table.
Excellent. So who is the monarch at the moment?
King Charles.
Okay, and can you tell me what you had for breakfast this morning?
A wrap.
Okay, and what did you have for breakfast yesterday?
Cereal.
Super, thank you. I just gave you 3 words to remember. What were those?
Ball, cat, table.
Excellent. So I agree with you that it appears that there's an element of low mood. I've not got any worrying factors from the history and the examination that we've just done. I would like to add some extra tests on. I'd like to do some blood tests to have a look to see if there's any signs of anemia, which might also contribute to the tiredness. So a full blood count. I'd like to check your renal and liver function, just in case we do need to give you a medication. And I'd like to check your thyroid status as well, because that can have an input with regard to fatigue. Would you have any problems with that?
No, that's okay.
Super. So we will organise that for you. Thank you very much for your time today. Do you have any questions for me?
No.
Thank you. So, in terms of the mental state examination, looking at Tava's appearance, he was appropriately dressed for the climate and the time of year. He appeared to exhibit good personal hygiene and had no obvious elements of dishevelment. I had no concerns about his appearance. In terms of behaviour, there was a slight reduction in eye contact, a slightly negative effect, which was congruent with the low mood that he commented of. There was a slight reduction in free movements, but overall his body language was open. He was turned towards me. There was no obvious resistance to the consultation, and I would describe his appearance and behaviour as appropriate for his presentation. And I would describe his behaviour as appropriate for the setting. With regard to the speech, although there was a slight reduction in volume, we had a reasonable tone and a slight reduction in cadence, but there was no obvious issues with fluency. There were no abnormal words, and there was no evidence of pressure of speech, nor any evidence of paucity of speech here. In terms of the mood, as mentioned, it appeared to be congruent with his affect. We had good insight with regard to confirming that his mood was objectively low at home and subjectively low from himself. I would agree that my objective assessment does support a low mood. In terms of his thoughts, there was no obvious issues with a thought form disorder, so no problems with persecutory thoughts, no issues with grandiose thoughts or thought disorders with regard to reference. There were no abnormal perceptions nor evidence of hallucination. In terms of cognition, he was orientated in time, place and person. There was no significant impact with regard to concentration, and he had good fluency with regard to the questions, and he showed no obvious signs of memory impairment. Overall, I'd say a reasonable differential diagnosis is that of low mood, possibly a reactive depression based upon examination, and there's also the possibility of a biological disorder such as anemia or a hypothyroidism, which may be causing a mild low mood.